Joining us for some insight is Dr. Jared Skillings, Director of Behavioral Medicine at Spectrum Health. Thanks for joining us today.
Thank you for having me.
We have had, unfortunately, several examples just in the recent years of some very horrific events that have happened in the country. How do people begin to cope with things like this? When they see this happening and they watch the news, it's difficult.
This is another tough time in our country, and first of all, I'd like to say my thoughts and prayers and my families are with the folks who have suffered this tragedy, and also with the caregivers. There's a couple of ways that we could think about coping. For adults, for example, you have to at some point say enough is enough. There's a lot of media coverage in all kinds of different areas, and so seeing the pictures over and over and over at some point doesn't provide you with more information. It simply becomes overwhelming. Another couple of ideas. One is that as adults, we use our thinking and our logic to control our emotions. So one of the things we have to remember is that even though there's a lot of media coverage on these tragedies, these actually happen really very rarely. Also, if you look at the number of people who are involved, even though the tragedy for the folks who are injured is really awful and we need to remember those folks, the number of folks who are really injured is very small. Last year, for example, there were over 26,000 runners. So we have about 143 the last time I heard folks who are injured. So in terms of thinking about yourself as being safe, the number of folks who are injured in these tragedies is very small.
So when you talk about that, you mentioned safe. Safety is an issue, I think, where people feel like, is this going to happen in my neighborhood?
That's right.
You know, when we talk about schools, when we talk about this situation, and it does leave you with this sense of, what is my level of safety?
It feels uneasy. Another example, this is a little bit on the national scale like when someone is diagnosed with a difficult medical problem in your family. If someone's diagnosed with cancer or they have a heart attack, a lot of times family members will start wondering whether they're having the same kinds of symptoms. This is the same issue. So we have a national tragedy, and then now the folks in Grand Rapids are suddenly afraid that that might happen here, closer to home. So that's a really common adjustment that we all have to make.
We don't have a lot of time, but coping strategies for adults and for kids.
Yeah. For adults, it's really using the logic and some of the strategies I mentioned to try to control the emotions. For the kids, one of the things as parents we need to remember is that the kids will mimic our own emotions. So try to stay calm. Don't go over the gory details, but acknowledge that it happened to the kids. And a couple of other pieces. Make sure that you talk to the kids about the positive helpers who are involved. Focus on the doctors and the nurses and the first responders, and also remind the kids directly. Tell them that they're safe and it's going to be okay.
And that's what they want to hear from mom and dad.
That's really helpful. And frankly, it's a good reminder for us to say that when we say it out loud.
Yeah, that's true. Jared Skillings, thank you so much for joining us. We appreciate it.